I'm a dermatologist, and today we are covering 5 tips that everybody with acne should know about and follow daily. Acne is one of the most common conditions, and nearly everybody suffers from it at some point in their life. And there's a ton of different remedies you can try, and everybody claims one thing works when one thing doesn't. And so when you go online to get advice for acne, you want to search out somebody who treats it every single day, and that's what I do in my clinic. We use topical medications, oral medications, antibiotics, Accutane. We use chemical peels, lasers, you name it. We're going to cover some basics today, so if you're just getting started with acne, hopefully these will be valuable for you. We're going to dive into tip number 1, gentle cleansing. When you have acne, you do want to maintain clean skin. I recommend that you find a gentle, fragrance-free cleanser, and primarily you're going to wash just with your hands. You want to avoid harsh scrubbing, things like loofahs or exfoliators, gloves, things like that. You don't necessarily need to use medicated cleansers because there are other ways to get medicines on the skin. There may be a time for medicated cleansers, and we'll cover that topic in a few other videos. But in general, 1 to 2 times a day, you should be cleaning with a gentle, fragrance-free cleanser. I will have some examples down in the video description, but I love to recommend mass market brands for this because they work really well and they're not terribly expensive. So I really like the Hydro Boost line from Neutrogena, the Gentle Cleanser or Hydrating Cream to Foam Cleanser from CeraVe, and the Lipicar Cleanser from La Roche-Posay. So cleansing does a couple of different things. It's going to remove dirt, oil, makeup from the skin if you're washing at night, and in the morning time you're going to be removing excess oil that may have accumulated as you slept. It's also important to clean your skin after physical activity if you've been sweating. Now that can seem like a lot of cleansing, and that's why you generally want to have a gentle cleanser. If you are on the go and you've been at practice or you've been competing in a game or exercising or just playing outside and you're sweaty, I do think that there is a place for cleansing wipes in that circumstance, because you may not be able to rush to a sink and wash your face and then you've got to go through reapplying stuff. Now tip number 2 goes along with cleansing, and that is don't over cleanse your face. This is where generally I like to recommend starting with a gentle cleanser that doesn't strip too much of the oil off of your skin, because that could lead to dryness. If you have a drier skin type, you may only want to wash with a cleanser once a day, and then in the morning maybe you just splash with some water just to kind of freshen the skin up. But you don't want to over cleanse, so you shouldn't be rushing to the sink to cleanse 3, 4, 5 times a day. You are likely to just dry yourself out if that is the case. I see this from patients all the time, that they're really over cleansing their skin. They're trying to scrub away their acne, but the problem with acne is that it starts deeper in the skin. It's not just a surface problem, and so cleaning the skin at the surface does not necessarily impact some of the deeper things that are going on with your skin, but you can actually damage the skin, cause dryness or irritation by cleansing too frequently. So keep it to once or twice a day, plus you can cleanse after you've been sweating. Tip number 3 is when you are shopping for skincare products or anything else that is going on your face, you want to look on the label for something that says non-comedogenic. This is a fancy way to say it won't plug up your pores and cause more acne than you already have. Now, it should be pretty apparent on the labels of most skincare products that it is non-comedogenic. When you're using a cleanser, a serum, a moisturizer, it's important to look for that, because if you're putting heavy things on your skin that have the potential to plug up your pores, you'll end up causing more acne than you already have, and that certainly isn't going to help you get to your goal of clear, healthy skin. This next one is a big one, and I was certainly guilty of it as a teenager, and that is no picking or squeezing your pimples. This is in general a bad idea for a couple of reasons. The first is that most of the time when you pop a pimple, although some of that may come out the skin, out through the pore, there is a risk that that blackhead, pustule, whitehead, whatever it is, can rupture underneath the skin just as easily. And as that material goes out underneath the skin, it will lead to more inflammation and it will increase your risk of scarring. So that is a perfect example why you shouldn't pop your pimples. If you look at extraction videos from dermatologists or estheticians on social media, you'll see that they're often using specialized tools. They may be using a lancet or a needle to open up the top of the pore, and then using a comedone extractor or similar tool to put pressure around the outside of the pimple rather than pushing down and in on it. When you put pressure on the outside of the pimple, If it does come out, it's more likely to come out the top and less likely to rupture underneath the skin. Another reason that you shouldn't pop your pimples is that you're creating a new injury in the skin that can take longer to fade, and you're more likely to experience scarring or post-inflammatory hyperpigmentation. That is the dark marks that happen when you get acne that can stick around for weeks and weeks on end. Now that we've covered some of the basics on acne, the number 5 tip that I have is what kind of products should you look for that actually treat acne? We've talked about cleansing, we've talked about the proper time and frequency with which to cleanse, we've talked about not popping your pimples, but what are the products and ingredients you should be looking for when you go shopping for products over the counter? Well, in general, I really like products that have a retinol in it, and probably the best one over the counter that is really designed to treat acne is adapalene. Adapalene goes by the brand name Differin, and it used to be prescription only. The proper way to use a retinol like Differin is you should wash your face at night and then make sure your skin is totally clear. Once your skin is clear and dry, you don't want to put a retinol on wet skin. You'll take a pea-sized amount of your Differin gel, dot your forehead, chin, cheeks, and nose, and then rub that in. You don't want to get it too close to the eyes or the corners of the nose. Those are areas that are more likely to experience irritation. But once you've put that thin layer on, you can then follow that up with a moisturizer. I often recommend that when starting a retinol, you only do it every 2nd or 3rd day because they do have the risk of causing some dryness. You want to start slow and let your skin adjust to it. If you can work up to daily use, that is ideal, and you're more likely to see improvement from the consistent use of a retinol. A couple of other over-the-counter ingredients that are easily accessible would be benzoyl peroxide and salicylic acid. Let's talk about salicylic acid first. This is a beta-hydroxy acid, and it is an exfoliant. And so when you put it on the skin, it'll come at varying concentrations, and over-the-counter, you can generally find up to a 2% salicylic acid. This will lightly exfoliate the skin. For some people, it can cause some redness or irritation, but in general, it is gentle. So you put that on, it does help to remove excess oil from the skin. Salicylic acid is a little bit better at dissolving some of those sebaceous filaments and getting rid of blackheads and whiteheads, so it can be a really great addition to comedonal acne. Benzoyl peroxide, on the other hand, is an antibiotic essentially. It kills the bacteria that cause acne. It's also got some comedolytic properties, meaning it can help to open up and remove blackheads and whiteheads. So as an antibiotic, it helps to kill those bacteria that cause acne, and to date, we don't have any documentation in the literature that the bacteria have become resistant to benzoyl peroxide as compared to some of the prescription antibiotics like clindamycin and erythromycin. So benzoyl peroxide is one of my favorite personally to use. If I have a pimple that does come to the surface, I like to put benzoyl peroxide on it, and it helps to get that to go away faster. One thing to be aware of when it comes to using benzoyl peroxide though is it is a peroxide. It can bleach fabric. And so if you're putting that on at night and you have a pillowcase that is a certain color, like a darker color, it can start to turn that orange. So I recommend using white pillowcases or old pillowcases that you don't care if they get stained. Sleep with an old t-shirt on if you're putting that on your chest, back, or shoulders, because some of that will come off at night and could stain your sheets. Now, benzoyl peroxide and salicylic acid can be found in cleansers. So when we first started the video, we talked about using a gentle cleanser, but sometimes when you're using benzoyl peroxide or salicylic acid as a leave-on product, it will just cause too much dryness for the skin. And in that case, you might find better efficacy from using it in a cleanser that has a short contact time with the skin. It's only going to be on there for 60 seconds, maybe up to 2 minutes, and then you're going to rinse it off. So it's not staying on the skin and causing dryness over several hours. So if you do use a medicated cleanser, you want to use it just probably once a day. Twice a day may risk more dryness and irritation, and so in that case, it can be helpful to have a medicated cleanser at the nighttime and just a gentle cleanser in the morning, or vice versa. It doesn't matter that much when you use one versus the other. There's a number of other things that you can find over the counter that have some efficacy in acne, but probably not as strong as adapalene, benzoyl peroxide, or salicylic acid. And those would be things like mild exfoliants with glycolic acid, or things like niacinamide. And sometimes you'll find these combined in one solution. And you can try those out, just make sure they're not causing too much dryness. Remember that everybody everybody's skin is different, and no two people will react exactly the same way to the same acne regimen. So if you find that something isn't working for you that may have worked for a sibling or a friend, you just need to switch it up and try some different things. And as always, if you're not able to control your acne with over-the-counter regimens and following these tips, that is the perfect time to go seek out a board-certified dermatologist to create a custom plan that may include prescription medications. As derms, it's our goal to help you clear up your acne as quick as possible and get you on a regimen that is sustainable and affordable over the long term. And so look for a board-certified dermatologist through the American Academy of Dermatology website. They have a derm locator on there, and you can find somebody close to you. I hope some of these tips are helpful for you guys. I've got a lot of other content on the channel regarding acne, and a couple of videos coming up here are going to address some of the specifics of treating acne with Accutane. I know that's a topic many people have questions on, so I invite you to hit that subscribe button so you can get all the latest on the proper care of acne with over-the-counter and prescription medications, and I'll see you guys on the next video.